Sorry if you are seeing Arsenal and you don't support Arsenal.
Mine was my YouTube was Nottingham Forest, where I support Newcastle.
Okay. I hope you can see my screen, because currently I don't think I can see anyone from my screen, but I hope you can see the presenter view. Is that okay, Alosh?
Yes, we can see the screen.
Okay. Good evening, everyone. My name is Tanimola Martins. I am born and raised in Nigeria, but I'm currently based in the UK. I work at the University of Exeter as a researcher, and I also teach on the Masters of Public Health program. So if you're interested in coming to Exeter to study, you might want to reach out. My research focuses on inequalities in cancer diagnosis, and I've done that for quite some years now. Before then, I studied clinical rehabilitation in Nigeria. I went to the Obafemi Awolowo University, and then I did some further studies here in the UK to be where I am now. So it's work in progress. There are no experts in all of the subjects. We are all learning. In fact, in many clinical conditions, the patient is the best expert. So some of the things I'm going to be saying today, you might have a different opinion. Please do feel free to stop me, ask me questions. As much as you're here to hear from me, I'm also here to learn from you. Okay, so the things I'm going to be sharing today are the things I like to share with my friends, with family, with people who are close to me, but actually the things I like to remind myself about as a man and also as a Black man. Because as we approach certain age, we are all going to be experiencing changes in our body. And one of those changes happens in our prostate. One of those things I try to remind myself is about the prostate gland itself, which is where I want to start this conversation. The prostate gland is a reproductive organ in the body. And because of the position it is located in the pelvis is where you have your buttocks. It's just space between your abdomen and your thigh. So it's quite hidden a little bit. But I'm sure most men will recognize what you can see on your screen here. You can see the penis. You can see the testis and the spermatic cord that links directly to the gland itself. So this is the prostate gland. It's fairly tiny. It lies below the bladder. The bladder is that organ that collects urine and stores your urine until you're ready to expel them out. So it's about 5 centimeters, the size of walnuts. If you eat kola nuts, it would be slightly bigger than that, but it's fairly small. What does it do? The prostate gland is part of those organs that produce the semen. And that semen, it nourishes the sperm, it protects the sperm, and it provides that fluid mechanism through which the sperm can, go on its journey to fertilize the ovaries. So that's all I'm going to say about the gland at this stage. But that is it. It's fairly small and it's fairly hidden. Now, what is prostate cancer? Like any cancers in the body, when a particular cell in the body starts to grow in an uncontrolled manner, the organs start to expand. It can spread to other parts of the body if it's not checked or treated. So if you open the pelvis and you cut through all of the organs there, this is roughly what you will be seeing. Here you have the bladder again. You have the prostate gland there, nice and smooth. You can see this tube. It's called the urethra. This is what helps you to empty your urine when you're ready to urinate. And you can see, when I show you the next image, you see the difference between a normal prostate gland and the one that is going through the cancerous process. And that's the one. So as you can see there, if you look at the sizes, of both prostate, you can see this one nice and smooth. You can see the urethra, you can see the space quite open. But here, when the cancer starting to develop, you can see here is almost occluding the urethra. Also, there is pushing on to the bladder, and this is when a man starts to experience problem relating to urination. You can imagine there, if it's occluded beyond this level, the man may start to strain when they are urinating, which may lead to blood coming out of the urine or having difficulty to urinate. I must say that naturally the prostate will enlarge as we age, and not all of the enlargements are cancerous. So there's one we call benign prostate hyperplasia. It's just an enlargement. It's not going to become cancerous. But when it becomes cancerous, that is when it's really, really important that we start to look at it. Sometimes benign prostate hyperplasia might need to be treated because of the discomfort it brings to the man. So I just thought I'd show you this slide to give you a flavor of what it looks like in real life, and how some of those things men experience start to occur. Okay, now that we've talked about prostate gland itself, what about who gets prostate cancer? I suppose the first thing to say that this is a disease that affects man or trans women only. So a man that has a prostate gland may have prostate cancer. And as you can see from this slide that I'm showing you, it affects men from all around the world. The darker the shade of blue you're seeing in this slide, the higher the number of men in that particular country that comes down with prostate cancer. So if you take United States, for instance, Brazil, many countries in Europe and Northern Europe, Russia, Australia, and New Zealand, and when you look in Africa, it's much higher in Chad for some reason I'm not sure at this moment. In Zimbabwe and several other countries in Africa, you can see the shade is getting slightly darker. But for the most part, it looks as though people in Africa, that is slightly not as high as some other countries we see around the world. And let's not forget the people in Caribbean islands. The incidence is also much higher. But all around the world, there are over around 1.5 million men or new cases of prostate cancer are diagnosed per year. And when you look, so I'm taking a few countries here for example, just to give you a flavor. In the UK, over 50,000 men are diagnosed per year. In the United States, the number goes up to 300,000 per year are diagnosed. In China, it's 130,000, while in Nigeria, it suggests that about 18,000 men are diagnosed with prostate cancer. I suspect the number in Nigeria will be slightly bigger. A, because data are probably not as accurate as what we have in the UK. B, because a lot of men might probably be dying from other causes of death. And so maybe they don't live long enough to have prostate cancer, but the cases may be a lot higher than 18,000 per year. Okay, so that's what it looks like around the world. Talking about who gets prostate cancer, it's important to understand who are at risk, because really we don't particularly know the cause of prostate cancer, but we know there are risk factors. And one of the risk factors is being old. People who are over the age of 50 are at higher risk of prostate cancer. And then if you have a family history of prostate cancer, say a father, a brother, or a grandfather had a prostate cancer, I think such people should start to look closer into their prostate health. Also, if you have a sister or a mother that have had breast cancer or ovarian cancer, or in fact, any cancer that is within the family, I will be looking after my prostate health if anybody within the family has been diagnosed with any form of cancer. But it's particularly more prevalent when you have the BRCA gene, which are linked to breast and ovarian cancer. Black men are particularly more likely to be diagnosed with prostate cancer, and not just more likely to be diagnosed with the disease, they also tend to develop the disease at a younger age. So you get some men roughly about the age of 40, 45 are having prostate cancer, whereas in white men, they can be much older before they have the disease. Okay, please do feel free if you think I'm moving too fast. Feel free to drop me a question or stop me. Now, we've talked about the gland itself. We've talked about who gets it. What about what happens afterwards? Who die from the disease? Currently, around 400,000 people are estimated to die from prostate cancer around the world. And this number is expected to rise to around 700,000 by the year 2040. In fact, in terms of the incidence, I showed you earlier that 1.4 million people are diagnosed by year. That number is expected to rise to 2.6 million or thereabout by 2040. And you can ask me why the numbers are rising later on. But this slide is showing you the number of people or the rate at which people die from prostate cancer around the world. Now, compared to the slides I showed you earlier, where when you look at Africa, it looks like everything is light blue. Remember, the darker the shade, the higher the number of people diagnosed with the disease. But when we get to death, suddenly, if the shades are looking darker in Africa, even though the incidence, the number of new cases are much lower, the number of people dying from prostate cancer in Africa are considerably higher and much higher than elsewhere in the world. But not just Africa. If you look at the Caribbean islands and some parts of the South America, quite a lot of men are dying from there. The Caribbean island and Africa are particularly interesting because it looks as though Black men are not only more likely to be diagnosed with the disease, it looks as though they're more likely to die from it. Again, I picked a few examples here. Remember, in the UK, about 50,000 men are diagnosed per year. Roughly over 11,000 die from it in the UK, compared to the US, where about 35,000 men die from the disease per year. In China, 47,000, while in Nigeria, 11,000. And this is important. Remember, we said 18,000 or thereabouts men are diagnosed with prostate cancer per year in the UK. 11,000 dying suggests to me that the mortality rate is really, really high in that country. Roughly about 60% are dying from the disease, possibly because they are getting late-stage disease or more aggressive disease. So that's what it looks like in terms of who dies from the disease. And similar to the risk of getting the disease, the risk of dying is considerably higher for men over the age of 75. And I think this is fairly consistent around the world. When you look at the highest number of people dying from the disease, they tend to be in that age bracket of 70 years and over. People who develop aggressive type of prostate cancer are more likely to die from it. And when I say aggressive, this is a disease that is growing very, very fast. And one of the signs that can tell you this is aggressive is younger age of diagnosis. If a man is less than 50, it is likely they have aggressive prostate cancer, because it takes roughly 3 decades for some of this disease to grow, to start to impacts on a man's life. And so if this is happening at the age of 40, you'd imagine that does it started when they were 20 or in their 20s? So aggressive form of prostate cancer can quickly grow and start to spread elsewhere in the body. And so the rate of dying with an aggressive disease is very high. The same goes for people who are diagnosed with late-stage prostate cancer, which is stage 4. There are ways in which doctors grade prostate cancer. When a man is diagnosed with stage 1 and 2, I'll show you later on, their risk of dying is much lower than when they are diagnosed with the later stage, stage 4, which means it is already spreading to elsewhere in the body. And as we've seen in the slide, Black men are particularly more likely to die from prostate cancer than men of other ethnicity. Particularly Asian men are the least likely to die from it compared with men of other ethnic backgrounds. Comorbidities is when you have multiple concurrent disease. Just imagine a man that is having, let's say, a kidney problem or a liver problem, now having prostate cancer. That can complicate treatment for the prostate cancer or even any other conditions they have, and that can compromise their immune system their health in general, which means they can die quicker than men without those other coexisting conditions. Now, the final point here is also very important, might be the case in many, many African countries and low-income countries, because there are limited access to treatment. Not just the treatments, maybe the drugs or radiotherapy equipment, but also for specialties. A lot of us from Africa will travel, we leave our country behind, which means some of those countries may not have the expertise you need to treat some of these diseases. And when the expertise are available, they're probably in the private hospitals, which means a lot of people may not be able to afford it. And so may not have the treatment they need when they have prostate cancer, which can also lead to early death. So I'm going to have a quick pause here because I have a quick quiz for you all listening to me. You can pop this in the chat or ask us to unmute you to answer this fairly easy question, which is, what are the early warning signs or symptoms of prostate cancer? So you can pop it in the chat or ask for you to be unmuted. Right, I can see someone saying difficulty urination.
Potentially blood while urination.
Pain. Weight loss. I like that one. Whoever said weight loss might be a doctor, I suspect. Yeah. Okay, pain during urination. Yes. Any more? Lethargy. Again, this might be a doctor. Bleeding. I probably mistakenly mentioned a few of them earlier. So, okay, good. I'm glad people are listening and people also have good knowledge of this frequency urination too. Absolutely. You're all absolutely spot on there. So I'll move the slide on. Okay, so well done to you all who mentioned difficulties starting to urinate, to pee, or straining when you're trying to pee. And if you remember the slide I showed you earlier, once the glands start to constrict or squeeze in the bladder and the urethra, mechanically you can see this happening in real life. Feeling the need to pee when you've just finished. Again, when you're pushing in the bladder, then the urine just keep flowing without real control, as the case may be. Having a weak flow, it's fairly difficult to explain what that means, because this is sometimes contingent on how much you've drunk in the day. Especially if you drink coffee and you're not drinking enough water, you might feel weak urine sometimes. And but this is when you've drunk well, but it still feels weak. You will know this if you know your body well. Stop and start is similar to just when you've just finished and you still feel like going again. Urgency, needing to pee urgently. This also happens. Needing to pee very frequently. Someone said earlier, during the day or night, you're waking up a few times to go to pee, and maybe this is unusual for you. That might be ringing alarm bells. Blood in urine, blood in semen. Have I missed a point? I think so. This is what I should have started, and this is what none of you mentioned. And it's the fact that most prostate cancer in the early stage actually do not have any symptom. You will experience nothing in the early stages of prostate cancer, and most of those times are the time we can actually achieve the best result. So if you're expecting to have symptoms before you seek help, you might be incubating something really, really serious, particularly if you have a family history of any of the diseases we mentioned earlier. But once it starts to develop, we can see all of these symptoms. Just to say that it is not always the case that when men have the symptoms, they definitely have prostate cancer. There are several reasons why a man will experience any of these things. I dare say women too may experience some of these problems. When you have urinary tract infection, you could have all of these things. For a man, if they have benign prostate hyperplasia, which is the benign form of enlargement of the prostate gland, they will also experience many of these symptoms. So it's not always the case that this is a bearer of prostate cancer as news. Okay, so there are other symptoms to think about. Someone mentioned fatigue or lethargy, weight loss. Weight loss can be a good thing if you're trying to lose weight, but if you're not trying to lose weight and you're suddenly losing weight, you might be. In fact, fatigue and weight loss are classic signs of some many cancers, including colorectal, not just prostate cancer, but several cancers. Low back pain is one of the commonest first thing men go to seek help about when they have low back pain. Most men with erectile dysfunction will sometimes be hiding and not take it seriously, but erectile dysfunction could be an early warning, maybe not early warning, actually, it could be a sign of prostate cancer. So these are other symptoms or signs men may experience and should seek help with a doctor if they do experience any of this. So that takes us to the next level. So we've talked about what the gland looks like. We've talked about who is at risk of having the disease. We can get it and the fact that it happens all around the world. We've also looked briefly at some of the early warning signs and symptoms you might notice. But what then when you notice all of these things? Or what then when you realize that somebody within the family has had a cancer? In the UK, most men will generally go to their GP first. It might be different where you are elsewhere in the world, but in the UK, before you can see a doctor in the hospital, you have to have seen somebody who is called a GP in primary care. It's similar to what you call family doctors in America or your local clinic in Nigeria. So men will present with their symptoms to this clinic, and their GPs, family physicians, whether they have symptoms or they are worried about prostate cancer. And in the UK, the GP will generally do some assessment and then decide whether or not to refer such men to specialists within hospital, where further analysis, assessment and treatment can then be implemented if they found prostate cancer. So this giving you just a bit more about what happens here in the UK. Doctors will ask you questions about the problem. They will ask about family history of prostate cancer, breast, ovarian, and several other cancers, just to make sure that both of you are thinking or are on the same page. They will also do a blood test. It's called a prostate-specific antigen test. This is something they look out for in the blood. It's produced by the prostate gland itself. They look at the level of that prostate-specific antigen in the blood and decide if it's too high. They would make a decision whether or not to refer a man to the hospital for specialist investigation. Digital rectal examination is rarely done in the UK these days because a lot of men don't like it. This is when the doctor puts a finger via the back passage to feel the prostate. It's actually a fairly good test. It's just the embarrassment associated with somebody putting the finger up the back passage that most men don't like. And some GPs don't even like it either, especially when you have a different gendered GP. It might be difficult to navigate that, but it's a very, very good test that the GPs do carry out here in the UK, but rarely, and maybe much more in Nigeria and elsewhere. What also happens here in the UK is once patient, my slide is not moving, just yes, it's moving now. Once patient is referred to the hospital, we now have what we call MRI. Now, this is a game changer in the UK. In the past, when a man is referred to the hospital, usually they will have to go through something we call biopsy, which they still do go through. But the problem with the biopsy then is it's more or less a blind biopsy, because they just try to, what biopsy means is just to pick aspect of the prostate to do further analysis to see whether there are real changes going on in the prostate gland itself. But what the MRI does, magnetic resonance imaging, I don't know how to describe it in other lay terms other than just imagine when you're doing your x-ray, but this is more technical test than the x-ray. It shows the prostate gland, it shows the doctors where there are changes going on, inflammatory changes, so they can go into that spot and collect samples for their biopsy. I always try to show this needle because a lot of people don't know what some of these processes entails. The biopsy needle is that long. It's just to scare myself. It's not for you. But, you know, this is one of the things they will need to put through. But they have more modern ways of doing the biopsy these days. But they just use that to collect a bit of sample of the prostate gland, and then they do further tests. And, you know, whatever they found then determines where they go from there. There are lots of different treatments available these days, which I'm not going to go into detail today, but lots of prostate cancer treatments are quite effective, as you know. Okay, quick question for you there. What is it like when you have a health problem? Where do you go? Where do you ask for help? Wherever you are, can do you have the GP situation like we have here in the UK, or you just go to the hospital straight away? Anybody listening?
We have got in India, we've got PHC, which is Primary Health Center.
Okay.
So for £2, we'd be able to go there and then speak to a doctor, and then obviously at that point they would be able to refer us to any more hospitals, specialist hospitals.
Today's got his hand up. That is fairly similar to what we have in UK. Today, do you want to say something?
In Nigeria, we don't have GP. We go to the hospital. When you get into the hospital, you see the doctor, and there the process starts. Or you go to a private hospital where you have yourself checked and made references at the end of the day.
Excellent. And what you said is similar to what people are putting in the chat, and I'm not surprised. And which is the problem, isn't it? When you go to the hospital, which is a specialist center, a referral center, chances are things may be a bit slower than most men will expect, and could be frustrating for some men. The corollary here in the UK is you might have to wait much longer before you get that specialist referral here. So yes, those in Nigeria, yes. And somebody says straight to the hospital in the USA. Obviously, in that part of the world, there is an health insurance attached to the way they seek and get help, which means if you can afford it, you can go straight. And I think that's what today is also saying. If you can afford it, you can go to a private hospital and get checked. It's just good to have that feel. That will be a debate for another day, whether our system in the UK is actually what everyone else around the world should be practicing. Okay, to the hospital, then they ask them to do BSA. Fantastic. Thank you, Fatia Shoboyede. Okay, I think I've moved too fast. Okay, so what I was going to say here is things to note. This is really important because you will hear a lot about prostate cancer these days around the world, wherever you are. It is important for men to understand that a lot of prostate cancer are slow growing. In fact, for some men, it will never bother them in their lifetime. Okay, so, and that's why you have to be informed. You have to engage with evidence, with research, before you get, the persuasion to start treatment. You have to be sure that your disease is the aggressive type or is the fast-growing type. There are different tests doctors will do to check whether this is indeed prostate cancer they should be treating. But I know it can be stressful if somebody's been told they have prostate cancer and nobody's trying to do anything about it. But it's important for you to know, and I need to tell you that the vast majority of prostate cancer are slow growing. They will never bother this man in his lifetime. But when prostate cancer is found at a younger age, I mentioned earlier, if you're 40 years, 45, and you're starting to see some of these changes, difficulty. Remember, once you start to have difficulty peeing, or peeing often, erectile dysfunction, all of these things, it suggests that the prostate is already is enlarged. It's constricting, is squeezing the bladder, is squeezing the urethra. So symptoms is already advancing at that stage. So early age onset can be a sign of aggressive cancer that has to be treated. Like I said earlier, if you're diagnosed as stage 1, stage 2 prostate cancer, nearly all of the men will live. They will survive up to 5 years or more, and beyond. But when it gets to stage 4, late-stage prostate cancer, more than half of the men will die. So it is very, very important to engage with your health at this stage. Treatment is definitely life-changing. A lot of men may have incontinence, which means they're just generally passing urine with no control. A lot of men will have erectile dysfunction after treatment. Some men will have some of these features that you see in menopausal women, flashes. When it's cold, they feel hot. When it's hot, they feel cold. Different symptoms that you can't really explain to anyone. Mood swings, mood changes. Some men will have cardiometabolic diseases. You can have hypertension, as a result of the treatment. But there's what we call active surveillance here in the UK, which is they've done all of the tests and they say, well, this is likely a slow-growing prostate cancer. There's no need to start treatment. Let's keep doing PSA. They might be doing PSA maybe every 3 months, every 6 months, every year. And, they take notice of the changes in the PSA and decide whether or not to treat. It's an option that is available. Whether you're in Nigeria or wherever you are, you should always consider all of the options, because you have to think carefully that the treatment, once you start the treatment, is going to change life. And I know some of my friends who have been diagnosed with prostate cancer, they've written fantastic books since this. I don't know why. After cancer treatment, they just got all of this inspiration to start writing books, and they've written fantastic books. It's not always negative, but there are definitely life-changing consequences of treatment that you should be aware of. This question I was going to ask, but I don't think is necessary here in the UK. There's a lot of advocacy for screening, and some of us are saying, well, let's check the evidence. Currently, there's no real evidence that screening is going to be beneficial to the population. Now, let's differentiate what screening means. When you have symptoms and you go to your doctor, that, okay, I have a headache, can you help me? That is you seeking help when you have a problem. Screening is when we go into the general population, we go into the public, we test them. And I know some men in countries like America, they do what we call annual MOT. It might be good, especially if you have a family history, So this is what screening is all about. Go into the general population, test many, many men and see whether they have prostate cancer. The problem is we will find a lot of slow-growing cancers that we shouldn't be finding, that won't bother the man in their lifetime. We will treat a lot of men that maybe they need treatment. And so, but it's a philosophical question that people should think about, whether screening is the way out. I suspect in countries like Nigeria, it might be useful because a lot of people in that part are already coming with late-stage disease. It might be useful. In other countries where the system is, much more better established, maybe screening is not useful. But there are clinical trials ongoing to check whether we will need one. So I will leave it at that one. Okay. So I think these are this is my final slide, just to, what I think and what I tell myself that I need to do. And this is what I'm going to tell everyone listening to me. And if you're a woman, this is what you should tell your husband as well. I think it's important for men to know their body. We work so hard, we don't pay enough attention to our body. A lot of men, including myself, we just get in the shower, no moisturizer, get your shirt on, off to work. We have to look after our bodies. Know your body. Pay attention to changes. This headache is lasting too long. Why? I'm being funny these days. Know your body is the first thing I'm going to say. Know the risk factor for prostate cancer. So when you're approaching the age of 50, 55, this is a time you have to be intentional about your health. You can't, do the usual, I'm a man, once you're approaching certain age, you need to now start to take certain things seriously. Know the risk factors, the age is part of it. Know your family history of cancer. Now, I didn't even know anything about cancer in my family. My dad is just 71 years old. And in recent generation is the oldest living. So we don't know. We are using him as the lab subject to know what problem would be there in the family, because we don't know what history lies there. So what the point I'm making, a lot of men may not know their family history. You try and find out, ask people questions. This might just be a good time to ask your parents what has happened before you were born. And if you're concerned about prostate cancer, please do ask your doctor, your family physician. If you live in the UK, go and speak to your GP about it, whether you have symptoms or of a family history of any cancer. Talk to your GP about it. Ask for a PSA test. They will always, these days, they offer men anyway, because there's been a lot of backlash that they don't offer black men test enough. So do the test. And whenever you do a PSA test, don't take it when the doctor says everything is fine. All right? Doctors always say that, everything is okay, it's normal. Tell them what is the value, what is the number, and write it down. Okay, do your PSA test, write the number down, so that when you go back and do the test again, you can see if there's been any changes in your PSA. And there will be natural changes in PSA as we grow older, especially if you're athletic. There are so many factors that affect PSA, but when you note the numbers, you can tell whether there has been any changes, and that can, give you an indication of where your prostate health is heading. Overall, maintain a healthy lifestyle. The usuals, your exercise, alcohol intake. When I was back in Nigeria, our fathers used to have these separate plates where they pack them full of meat. It used to be a sign of wealthy, but at a certain age, you don't need more than 1 or 2 pieces of meat, because of course, there's no real evidence to link cancer to red meat or other meats that we consume, but obviously, too much sometimes can be unnecessary. But the final point I want to make is to make informed decision. All right, don't rush into any treatment. Find out about it. Research your health. Ask people. Seek second opinion when possible before you make that final decision. Okay, yes, I've got this disease and I want to treat it. Speak to your family. Carry everybody along as you do so. With that, I'm going to say thank you for listening.
Thank you so much, Dr. Tani. That was a very illuminating presentation, but thank you so much for